1 in every 4 couples in developing countries are affected by infertility. According to the World Health Organization, it remains a burden because of the myths and misconceptions associated with the issue. Today on Sound Health, we are looking at the prevalence of infertility in Nigeria. I'm Olasumbo Mudupe. Welcome to Sound Health. On innovation this week, researchers come up with self-administered human papilloma virus test. That's in a moment. Sound Health continues shortly. Please stay with us.
Families are an integral part of any society. They hold societies together, and intergenerational relationships extend these legacies over time. The family has the responsibility to protect, raise, and nurture children. As easy as it sounds, it remains a challenge for some as they experience difficulty in conceiving and nurturing their own. A major factor in this is infertility. According to United Nations Populations Fund, it is now a growing problem in Nigeria, affecting about 25% of the country's population. Medical experts say infertility is a considerable obstacle for women wishing to make a family and occurs when a poor reproductive system impairs the ability of the body to perform necessary functions of reproduction. The phase could be emotional and at the same time psychological for the affected.
Now let's discuss this further. Joining me now is a consultant gynecologist with the Bridge Clinic. He's Dr. Adewale Ibrahim. Welcome to the program, Doctor.
Yeah, it's a pleasure. Thank you. Nice to be here as well.
Okay, the statistics is on the rise. We have at least 1 in 4 couples affected by infertility. This was never the case in the past. Why do we have the prevalence now?
Thank you. Your statistics, about 1 in 4 couples, which that's an average of about 25%, having fertility challenge issues now is actually true. And like you said, it was not like that in the past. A lot of things have changed in our world. A lot of things have also changed in our society as well. And all these are the factors that have contributed to this increasing prevalence of infertility in our environment. And I think leading amongst this, has to do now with the career of our women, because the issue of infertility and age are closely related, largely because the higher the age of a woman, the lower the fertility potential of that woman, for certain reasons, which I believe we will still get to discuss, in the course of the program. So because we have a number of our women now who are pursuing careers, and in the course of pursuing careers, many women also tend to get into marriages quite late, and after getting into marriage at late ages, then the problem of infertility arises, or the fertility-related challenges now dawns on them. Secondly, or closely related with this, is that we have an increased incidence, of sexually transmitted infections, in our society today. And that could also be related to, the dwindling economic fortunes, where you have, a lot of, women needing, to have, multiple, sexual partners, in a bid to make ends meet, either directly or indirectly. And coupled with this, you understand, is the risk of sexually transmitted infections, pelvic inflammatory diseases, unwanted pregnancies, and complications arising from unsafe abortions. And then all these coupled together, you understand, are actually responsible for why we have an increasing prevalence of infertility in our environment.
So when should a couple worry about conceiving?
You see, generally the truth is that if you have a normal man and a woman who have no problems, and they are together, you understand, having regular unprotected intercourse, every day, their realistic chance of being able to achieve conception in a cycle, that is in a month more or less, is just about 25%. which you'll agree with me seems quite low, you know, because normally the expectation is that for people who are
Even
normal
on a daily basis,
you understand, their realistic chance is just about 25%. That is how inefficient the human reproduction could be. So usually, because of these factors, that's why we usually advise couple, you know, not to get worried or concerned until they've been having regular and protected intercourse for at least about a year. Because by the end of 1 year, we expect that over 90-95% of otherwise normal couples should have been able to achieve pregnancy. So if it's not happening, you understand, by the end of 1 year, then there is a cause, you understand, for concern. And those couples need, you understand, to seek help. However, it's also not in all cases that we actually need to wait, you understand, for up to a year. Because for some women, either prior to marriage or something, they're already aware that they have certain medical challenges, you know, which may pose, you know, a difficulty to their conception. Or for women, you know, who are already above the age of 35, they necessarily don't have to wait for a year. If it's not happening within 6 months or thereabout, then they should worry and then should begin to seek help, so that interventions or whatever are planned on or before 1 year.
Okay, in this part of the world, women are blamed for infertility. Is it just a woman's problem?
That is very, very untrue. Very, very untrue. I think those ideas or ideology used to be in the days of our forefathers. Because the truth is that the issues of infertility, you know, affects man and woman almost equally. That is, the contribution of the man and the woman to the problem of infertility, you know, is almost equal, you know, averaging at about 33%, you know, as it were. So the truth is that it's not just a woman's problem. The men or women, you understand, are involved as well, and we contribute almost equally, you know, to the burden, you know, of infertility in our society.
Okay, but according to the World Health Organization, we believe women are saddled with the responsibility of recreation. It has become a major challenge to treatment of infertility.
Yeah, that's true, and it also poses a challenge, you know, to treatment and management of some of these couples, because you find out that in a reasonable number of scenarios or situations, the problem is actually with the man, and the woman is otherwise normal. But unfortunately, the man or the men do not present to the clinic. So that creates, you know, a big challenge. And then as much as possible, you know, we usually advise or prefer, you know, to see clients as a couple, that is husband and wife. That is usually our first choice or option, as it were. But unfortunately, you know, in some parts, you know, you have the situation where you're the woman, you're the problem, you go and sort yourself out. And then even after the woman has done all her tests and everything seems normal and fine, it's still always difficult, you know, bringing the men in, you understand, for assessment. And basically, the truth is, all the man needs to do is just a sperm analysis. Unlike for the woman that needs to do so many different tests, blood tests, radiological investigations, assessments, and all that. So it's really so difficult, and that's why, you know, out there now there are a lot of advocacies. We have a lot of NGOs, a lot of groups, you know, trying, you understand, working hard, you know, to, you know, encourage our men, you understand, to as much as possible come with the women to the clinic where there are fertility related challenges. Because like we had said earlier, it's not just a woman's problem.
Aside from blocked fallopian tubes, weak uterus, and low sperm count, perhaps untreated STDs, sexually transmitted diseases, what are the other factors responsible for infertility?
Some of the other reasons why there might be fertility-related challenges, you know, relate to some women who have, you know, congenital abnormalities, congenital problems. You know, for some women, they have congenitally small uterus. In fact, for some women, the uterus is even absent, you understand, as it were. And then all this, you know, would create infertility. You also have some congenital problems where the ovaries are absent or non-functional. You know, a common one that we have is a Turner syndrome, you know, where the ovaries are like rudimentary. You know, they are non-functional. And then when there are no ovaries, obviously there is no follicle, there is no ovulation, and then there is no way pregnancy is also going to happen. Beyond this, one common thing that we also have in our environment here is uterine fibroids. Quite common, in our environment, common among blacks. But the truth is that fibroids on their own, usually are not responsible for infertility. Rather, fibroids would cause recurrent pregnancy losses or wastages. But however, you have certain situations where you've investigated the woman and the man, you've done everything. Everything seems normal, except for the presence of the uterine fibroids. Then in such scenarios, you may relate that perhaps it's the uterine fibroid that is responsible, for the fertility-related challenges. And that would also now depend on the sizes of the fibroids. Where are the fibroids located? Are they located directly inside the uterine cavity, or they are just within the muzzle or the body, of the uterus, as it were? So these are perhaps some of the common reasons, why we have fertility challenges in our environment. Then, of course, lifestyle also matters for the man and the woman as well. Smoking, alcoholism, all affect quality of the man's semen or sperms, as it were. They all have a negative impacts on this. So for men who, do a lot of alcohol, who do heavy smoking, you understand, they are actually at a risk of, having fertility-related challenges. Also, you have situations where you have men who have had surgeries or procedures, either as young children or in their adulthood. Common amongst these, you have herniorrhaphies, you understand, where there might be inadvertent damage to the vas deferens. The vas deferens is the tube that carries the sperm from the testes to the exterior, and where such are damaged during these surgical procedures, they could actually create or cause fertility-related challenges. One other important thing, and this is particularly important for our mothers, because we have a lot of people still making this mistake or this error, even in this modern society that we have now. It's very critical or important that once a male child is born, that the testes are closely examined, because you have situations wherein the testes are undescended. That means all you have is just the sac, but the testes are not there, because the testes are just within the abdominal cavity. They've not descended. They were arrested somewhere in the abdominal cavity in the process of their, coming down into that sac. So if you don't know early, by the time you are detecting late, that because the longer the testis stays within the abdominal cavity, it begins to lose its functional capabilities. So it's very important, because a lot of our mothers have made that mistake in the past. Some are still making it, because it's easy to assume that since the sac is there, that automatically the testis is within that sac, but it is not always the case. So our mothers are using this medium to appeal, to you, to make sure, we critically, examine the testes of our children, especially our male children, from time to time, so that peradventure, if there is any abnormality, it can be detected on time and taken care of before it becomes late. I think it's very important.
Okay, the World Health Organization cited some examples that lack of consistent definitions, tools, diagnoses, and all that, affect the management or report of infertility in couples worldwide. How true is this?
Well, that would have probably been true, maybe a couple of years back. But things are changing, even in our society.
Because with the level of advancement.
things are changing, and it relates largely because there is this notorious factor, if I may call it that way, which we call endometriosis, which causes a lot of problems. But for a long time, we used to think endometriosis was something that was just common with the whites, and that it was not a black man's problem. And that's also because we didn't have much of laparoscopic procedures available in the country. But over time, with more people now getting involved in doing laparoscopic procedures, either for diagnosis or for therapeutic purposes, we are finding out now that a lot of our women, actually have endometriosis that is actually responsible for the challenges. So that kind of woman in the past, when there was no facilities for laparoscopic procedures, you'd have otherwise done everything, think this woman is otherwise normal. Why is she not getting pregnant? So the extent of your the extent of the apparatus that you have, you understand, may also limit, the extent of your diagnosis. Perhaps in the past, that kind of woman would have labeled her as unexplained infertility. That is, you've done everything, you can't seem to see any reason why pregnancy is not happening. You understand? But with increasing, diagnostic tools, particularly laparoscopy, we're able to pick, a lot of these women now.
When should a couple seek medical help, and what are the basics you look out for?
Basically, there are various options, for treatment of, infertility. But the critical or the most important thing, has to do with the psychological support. Because for a number of these clients, the truth is, what they need more often than not is psychological counseling. You understand? And then once you're able to do that, for a number of them, they'll be able to achieve, pregnancy. You'll even be surprising that for some people, you understand, even after marriage, being able to achieve
just the pressure.
Yeah, being able to achieve good penetrative sex, you understand, is a big problem. And at times, some of these things are difficult to say out, and then they keep living with it, managing and everything. So the role of psychological counseling is also very key in this client. So the treatment will now likely dependent on what you see has been the cause, and then the treatment is usually in stages. We take it in stages.
Can you please shed more light on the assisted reproductive technology we have? I understand we have the IVF, the in vitro fertilization, and the IUI, that's the insemination. Can you please shed more light on that, and what are the differences between them?
In vitro fertilization, IVF commonly called, is a form of ART. ART being assisted reproductive technology. You understand? And then you have IUI. Strictly speaking, IUI is intrauterine insemination, and strictly speaking, intrauterine insemination is not taken as part of ART. Because once we say ART, that means we expect that there's manipulation of gametes. That means you're either touching the sperm and or the eggs, as it were, which is usually not the case, you understand, in an IUI. But in an IVF, we do that. So IVF is a form of ART. You understand, as it were. The other forms of ART, we have GIFT, we have ZIFT. Those are other forms of ART. As it were. So, but use of ART is usually like a last resort. You understand, in the management of infertility, except where there are specific indications, because there are some diagnoses that once you make, it's an IVF. Like a woman comes, she has done an HSG, both fallopian tubes are blocked. It's an IVF. That woman requires an ART. And because gone were those days when people used to try and do surgeries or procedures on the fallopian tubes to try and see if they could open up those tubes. But unfortunately, the outcome of those procedures were usually disastrous, and in the long run also had negative impact on the success of an IVF cycle. So because of that, these days, less attention, is paid, to those. So, but otherwise, for women who the tubes are normal, seminal analysis is okay and everything, there are still some little interventions, you understand, that may be done, you understand, with specific timelines. And where pregnancy is not happening within those specific timelines, then ART, could be considered as a last resort.
Okay, that was Dr. Adewale Ibrahim, a consultant gynecologist with the Bridge Clinic, and we have been discussing the prevalence of infertility in Nigeria. Sound Health continues with trending and home essentials. Please stay with us. It's still Sound Health on Lagos Television. On innovation this week, researchers showcase a self-administered human papilloma virus test. That's in a moment. Please stay with us.
Self-administered HPV test.
The human papillomavirus, HPV, infects nearly 80% of sexually active women. Medical screenings are vital to detect certain strains of cervical cancer linked to HPV. The virus causes over 250,000 deaths from cervical cancer a year. Nearly 85% of these deaths are in third world countries, where access to healthcare screenings is very low, if at all available. Strategies are needed to test and treat everyone, regardless of geography. Scientists have developed self-administered HPV test kits that include a swab and a test tube or mail-in box. The idea is that tests can be delivered to communities everywhere for women to administer their own test and send a sample back to a lab. By offering a greater number of women simple and accurate screenings for cervical cancer, self-administered HPV tests can save money and lives all over the world.
That's it on Sound Health this week. Hope you've learned a few things on the program today. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.